voting for you. You didn't. And the reason is that you probably, people in this district voted Chris Romer in for office. And shortly after he took office, he chose to resign to run for mayor of Denver. And unfortunately for him, was not successful in that bid. But when he resigned, there was a committee of precinct committee people who were asked to pick a replacement. And so I am the replacement that they picked. Now, coming in November, you get to decide if they made a good choice or a bad choice, because I will be on the ballot in November. And so hopefully at that point afterward, you'll know my name, or at least have seen it on the ballot. And I would like to start by, oh, here comes Senator Boyd. Come on up here. This is Senator Betty Boyd, and she is President Pro Tem of the Senate, which means she's like the Vice President, so we've got a big wig here. I'm charge of vice. And she has been chair of the Senate Health and Human Services Committee, and has been in the Senate for 8 years and in the House of Representatives for 8 years, and is really known as a leader in the healthcare field. And so she's been one of my mentors, and I'm so pleased that she's here with us today, because she's done a lot of the work with the Senate preparing Colorado for implementation of the Affordable Care Act. But anyways, just telling them about how they didn't vote for me, but how we'll be on the ballot in November. And regardless of how you vote, I would encourage you to vote. You know, there are countries all over the world where people are literally losing their lives for the right to vote. And in the United States, only 44% of us exercise that right. So not even half of us take the time to vote. So I would encourage you to find out a little bit about the candidates. If it's really confusing, because it does all feel like TV commercials, you can even just look at the parties that they're from and what the values of the parties are, and that might give you a better sense of who you match with. And take the time to let your voice be heard about what you think is right. If you're crazy enough to want to have a Politico give you more information, I can find lots of them if you're willing to talk your ear off about how you should vote and why, and feel free to let me know if that's of interest to you. But anyway, so thank you for coming. And as you know, we're here today to talk some about this whole Affordable Care Act. And actually, if I could have titled this, I would have said, "What's all the fuss about?" Because there obviously has been a lot of fuss about this in the media for the last 2.5 years, and I think a lot of people were hoping that we could stop thinking about it because the Supreme Court would strike it down, and that didn't happen, and some of us were glad about that. But I thought since it was not struck down and there was a lot in the media, that I wanted to spend a little bit of time at a town hall telling people what I think the Affordable Care Act means, and then letting Senator Boyd talk about what we're doing in Colorado for the Affordable Care Act, and then answering your questions and concerns about it. As some of you may know, I actually am a doctor by profession. I worked for the last 23 years for Denver Health and Hospitals, which is our public health care system in the state of Colorado. I've worked primarily at the Westside Family Health Center, the Sam Sandos Healthcare Center, and Sam Sandos' wife and son are here, Ethel and Tim. So thank you so much for your family's service to our community. And as a doctor, I got to experience the limitations of our healthcare system. Now, one of the great things for people is that most people are healthy. And as far as they know, our healthcare system is fine. And you don't really get to see what the limitations are until you get sick. And unfortunately, statistically, at some point, you're going to get sick, and at some point, you're going to die. And you'll need some intervention from the medical system, unless you're one of those lucky people who dies quietly at home in the night. And I think many of us hope that that's how we go, and not being part of the medical system. But so until you get sick, a lot of times you don't really understand what all the fuss is about with our healthcare system. But what I can tell you about it is that, unfortunately, it's become a game of how do I pick the healthiest person and get them to pay into me to give them insurance, so that hopefully I never have to pay for them to get health care. Because if we don't have to pay for health care, the insurance company saves money and the person's premium can be cheaper. So if you always insured people who were under the age of 30 who were completely healthy, it would be really cheap. In fact, 50% of the American public uses less than 10% of our healthcare dollars. So for most of us, we really don't pay a lot for healthcare. And what we're paying for really is for that day someday when we may get sick and we may need the healthcare system to be there for us. And so, so if you feel like you've been paying a lot for healthcare and not getting a lot, that may well be true. What you're helping pay for is our system, and for the day when in the future you may need to access that system. But anyway, because the game became, how do I get only the healthy people? The unhealthy people started having more and more trouble getting health insurance. And so you may know somebody who has a chronic illness like, say, diabetes or high blood pressure. And what they ended up deciding to do sometimes is just work for a big company. Because if you work for a big company, the big company doesn't discriminate against anyone based on illness, and you can always get health insurance. And then a lot of times in the United States, people get health insurance through their employer anyway. So in Colorado, about 57% of us get health insurance through our employers, and that applies to people like me who are employed by the state or the city and county of Denver, and it applies to people who work, say, for Hewlett-Packard or Collins, who used to work for the Gates family when they were here in town. People would get their insurance through their employers. But as the employment market changed, I don't know about you, but I don't know many people who've had the same job for 25 years. I'm a little bit unique in that regard. As the employment market changed, more and more employers did not offer insurance. And so the other 43% of us did not have an employer to get insurance through, or couldn't afford it. Because unfortunately, as many of you do know from your paychecks or from your family and friends, it's very expensive for insurance right now. And in fact, in Colorado, the average price for a premium for a family of 4 is about $16,000 a year. And so if you figure that the average family in Colorado makes $52,000 a year, unless you get it from your employer, you really can't afford to pay $16,000 for health insurance. And so the end result was that Colorado this year has about 830,000 people who have no health insurance. And so that's about 16% of our population. Our population is about 5 million people. And in addition to that, about another 600,000 are too poor to afford insurance, and so they have Medicaid. So that's another 13% of our population. And in addition to that, another 300,000 people who have health insurance. Even with their health insurance, it's too expensive for them to go to the doctor because they have high deductibles or high co-pays, or they just can't afford it. So really our healthcare system isn't working for about half the people in our state, and that's copied in many other states, which is why the federal government wanted to try and do something about healthcare to try and help more people have access to health insurance, because we are still not the country where if you die on the street, we're going to just let you die unless you have insurance. We need to figure this out. We are so compassionate and take care of people. And so the Affordable Care Act was passed to try and do two things. One was to be sure that everybody who was really poor could get on Medicaid. In Colorado, even if you make no money, if you're an adult without children, you never qualify for Medicaid. This year, that's changed, and 10,000 people will be able to get Medicaid, but that's supposed to be the safety net for the poor, and childless adults without diseases right now are very limited in their ability in Colorado. So that's one thing the Affordable Care Act did, is it said anybody living with an income less than $13,000 a year can apply and get Medicaid or government-funded health care. Now, I know you hear a lot of bad things about Medicaid, but let me tell you this, about 7 out of $10 in Medicaid actually are spent taking care of the elderly and the disabled. So taking care of poor, healthy people is pretty cheap. Only 3 out of the $10 in Medicaid takes care of poor, healthy people. Children are actually our best investment. They're really inexpensive, and we can really keep them healthy. So, so Medicaid exists for people in poverty, but really a lot of the money goes to the disabled and the elderly in Medicaid. And then the other thing that they said for expanding, getting everybody coverage, was that if you make less than $88,000 for a family of 4. $16,000 is probably a lot for you to afford for your premium, so you'll get a tax credit to help you purchase insurance. If you earn underneath $88,000 for a family of 4 or $22,000 for an individual. So the next thing that's in the Affordable Care Act is a tax credit to help people who don't have employer-sponsored insurance purchase insurance. And then they also said, we can't expect people to spend a limited amount of monies on health care. So again, if you earn under $88,000 a year as a family of 4, how much you have to pay out of pocket is going to be limited so that you can afford to get the medical care that you need if you need it. And those were the insurance expansions that happened. But with that, they did something called insurance reform. A lot of times people don't know this. Like I said, if you're healthy, you don't realize it. But if you're not healthy and you try to get an insurance policy, you could often be turned down. And not healthy could mean that you're over the age of 50, like I am, or that you're heavy, like I am. People don't want to buy me health insurance because they know I'm going to get old and I'm going to get sick, and so the insurance company doesn't want me. So that's that change in the insurance law is called, I'm blanking on the word, guaranteed issue. So you can no longer be denied because of pre-existing conditions, meaning because you have diabetes or high blood pressure, or because of risk factors, because you're heavy, because you're older. And so the insurance reforms that happen will start with guaranteed issues. So starting in January, anybody can get health insurance regardless of whether they have an illness or not. And in Colorado, a lot of our businesses are small businesses. But in order to start a small business, you have to be healthy, because it's hard to find insurance if you're not healthy. So all those people who've been, we call it job lock, who've been in their job and don't really like it but have stayed because of health insurance, starting in January can think about getting another job because they don't have to worry about being denied access to health insurance. So that's guaranteed issue. The other thing that insurance companies used to do that they're not going to be able to do anymore is, let's say you were healthy when you bought insurance, and then you developed breast cancer, and then they found out that in fact when you were 22 you saw a doctor because you felt a lump in your breast. They could say, hey, you lied to me, you knew you might have breast cancer, and they could cancel your premium, give you back your money, and say, I'm not going to insure you. That's called rescission. So that is now illegal because of the Affordable Care Act. The other insurance reform that happened is, remember how I said the game is get all the healthy people into your plan so that you don't have to spend it? Well, now the law is that you have to spend 85% of the dollars you get on health care, or you have to give it back to the people who paid for health insurance. And that's for a large employer, large insurance companies, and small insurance companies, the number is 80%. So actually this year, I think it's $1.1 billion are going back to consumers because the insurers collected more money than they needed for paying for health care. So that's another change from the Affordable Care Act as well. And then the reason it became controversial, there are also changes because we all know that health care costs too much, and that the United States spends almost twice as much as any other industrialized country in the world on health care. And there are a number of reasons for that. But one of the reasons is that we do a system where the more that a doctor does, or a healthcare system does, the more money they get. It doesn't matter if that makes you healthier or not. The more you do, the more you get. So if I keep you completely healthy and you never come to see me, I don't make any money. So we're going to try and change how healthcare is paid in the United States to paying for value instead of volume. For saying, I'm going to pay you this much money, and if that person gets sick, it costs you money, but if you keep them healthy, you make more money. And so there's a lot of payment reform things happening in healthcare as well to work on keeping the costs down. There's also this game played where you can't necessarily, each insurance company bargains individually for prices. So we're trying to make a bigger market so the company has a bigger group to bargain for prices with. Because the bigger your group, the better the price you get. And so that's another change that's coming as a result of the Affordable Care Act. And then the other final area that they're looking at is something called prevention, which is something that even as a general doctor, I don't think I put enough attention to. You know, as I said sort of teasingly, eventually we will all die, but how that happens and when that happens, we really affect on our own. In fact, 90% of our health is affected by what we as individuals do. Only 10% is affected by our expensive medical system. Now that 90% of our health, 30% is genetic, so you really can't necessarily change that. Once you're born with your genes, you have them. But 40% is behavioral. And what does that mean? That means that if you smoke, you have a worse health outcome. If you're heavy, you have a worse health outcome. If you don't exercise, and then the things we always think of: alcohol, drugs, accidents. But really the biggest contributors to early mortality and death are smoking and obesity and poor exercise. So those are things we can all take care of. But right now, nobody gets paid to help you do that. And so what they're trying to do is incentivize you to be healthier and your healthcare system to help you get healthier. I don't know if any of you have seen those Live Well signs around now. That's Kaiser's effort to try and get people to live a healthier life and be more aware of the things that we do every day that affect our outcome 10, 20, 30 years from now. So I'm going to stop there. That's basically an overview of the kinds of things that are in the Affordable Care Act. And then I am going to let Senator Hoy talk some about the actions that Colorado has taken with regard to how we're going to help people purchase insurance in Colorado who currently don't have insurance.
Thank you, Senator Aguilar.
Yeah, there's some seats up
And
here.
there's one over there, there's one over here too.
And here's some more chairs
Don't
too.
be afraid. Well, thank you. It's good to be with you this morning. I often have my town meetings on Saturday mornings too, and this is a robust crowd, so I'm glad that you're glad to see you interested in healthcare and in knowing what's going on legislatively in Colorado. I serve the district right next door to here,